Here is a detailed explanation of red blood cell RBC count. 1. Introduction. Red blood cell RBC count is a commonly performed blood test that measures the number of red blood cells in a volume of blood. Red blood cells are essential for transporting oxygen from the lungs to body tissues and removing carbon dioxide. Monitoring RBC count helps in assessing overall health and diagnosing various conditions such as anemia, polycythemia, and other hematologic or systemic disorders. 2. Definition. Red blood cell RBC count is defined as the number of erythrocytes, red blood cells present in a specific volume of blood, usually expressed as millions of cells per microliter or per liter L. It is a part of a complete blood count (CBC) test. 3. Indications. RBC count is indicated in various clinical situations such as evaluation of symptoms like fatigue, weakness, shortness of breath, suspected anemia or polycythemia, routine health examination, monitoring chronic conditions like kidney disease or bone marrow disorders. Pre-surgical evaluation. This test is used for diagnosing blood-related disorders, e.g. anemia, polycythemia, monitoring response to treatment, e.g. iron therapy, chemotherapy, evaluating hydration status, detecting internal bleeding or chronic blood loss, assessing bone marrow function. 5. Why do need of this test? You may need an RBC count to investigate causes of symptoms like dizziness, pale skin, and fatigue, monitor conditions affecting red blood cells, ensure your red blood cell levels are within normal limits, guide treatment decisions for blood disorders. 6. What happens during the test? A healthcare provider will clean your skin and insert a needle into a vein, usually in the arm. Blood is drawn into a tube and sent to the lab. The procedure takes just a few minutes. No special recovery is needed afterward. 7. How long for my results? Results are typically available within a few hours to 1 to 2 days, depending on the laboratory. In emergency settings, results may be available within an hour. 8. Prepare for this test. Usually, no special preparation is needed. Inform your healthcare provider about any medications, as some may affect the results. If it's part of a more comprehensive test, e.g. fasting glucose or cholesterol, fasting may be required. 9. Risk 2. The risks associated with an RBC count are minimal and may include slight pain or bruising at the puncture site, dizziness or fainting, rare, infection extremely rare, 10. Normal values. Normal RBC count varies with age, sex, and altitude of residence. Group normal range, million cells per kg, men 4.7 to 6.1, women 4.2 to 5.4, children 4.1 to 5. Note, values may slightly differ by lab. Interpretation of results. High RBC count, erythrocytosis, polycythemia. Causes: polycythemia vera, dehydration, chronic hypoxia, COPD, high altitude, tumors producing erythropoietin. Symptoms: headache, dizziness, flushed skin. Low RBC count, erythrocytopenia. Causes: anemia, iron deficiency, vitamin B12, folate deficiency, bone marrow failure, chronic kidney disease, hemorrhage. Symptoms: fatigue, weakness, pallor, shortness of breath. 12. Factors affecting results. Several factors can influence RBC count. Dehydration falsely elevates count. Overhydration dilutes blood. Altitude, higher counts at high altitudes. Medications, chemotherapy, erythropoietin, diuretics. Smoking increases RBC. Pregnancy may lower RBC count due to plasma volume increase. Recent bleeding or transfusion. Clinical significance. RBC count provides crucial insight into oxygen carrying capacity of blood. Helps in diagnosing, managing, and monitoring diseases involving anemia, polycythemia vera, chronic diseases like renal failure or cardiovascular disease, nutritional deficiencies, hematologic malignancies. 14. Know more. RBC count is part of complete blood count (CBC), which also includes hemoglobin, HB, hematocrit, white blood cell count, platelet count. RBC indices, MCV, MCH, MCHC, provide additional diagnostic information about size and hemoglobin content of RBCs. Advanced tests, reticulocyte count, iron studies, bone marrow biopsy, may be used for deeper investigation if RBC count is abnormal. 15. Conclusion. Red blood cell count is a simple yet vital diagnostic tool that reflects a person's ability to transport oxygen throughout the body. Abnormal values can signal underlying conditions ranging from anemia to chronic illnesses. Understanding the test, its preparation, and its implications helps in timely intervention and better health management. Thank you. Have a nice day.